Next up, let's talk about the miracle question technique. This is perhaps one of the most well known solution focused brief therapy techniques. As mentioned in the introduction, SFBT focuses on collaboratively setting outcomes with the client. So the miracle question, along with some other outcome setting questions, acts as the vehicle for this tenet. Keep in mind as you discuss these questions with the client that there is a difference between a goal and an outcome. A goal is related to what one wants from therapy, and an outcome is that thing they are achieving from the goal. For example, someone may state, I want to lose 30 pounds, which is a goal. But as you dig deeper, you may find out that they want to lose that weight because they state they want to be alive and healthy for their grandkids. This is an outcome. And when you help them identify this, it can be very, very powerful. The miracle question should be used at the start of treatment. It can be done before, after, or during your brief psychosocial and can be infused with your traditional information gathering during a first session. The goal of the miracle question is to help the client consider what their life would be like without the presenting problem or concern. This allows them to consider future possibilities. Once they answer this question, it opens the doorway to identify small, practical, and manageable steps that would result in immediate change. It also allows one to start realizing that life without that specific problem is possible. To ask the miracle question, you start by setting the scene for a miracle to have occurred. That means that the presenting concern is gone. How you choose to word the miracle question is really up to you, but an example would be, imagine that while you're sleeping tonight, a miracle happened. The miracle is that the concern that brought you here is solved. However, since you were sleeping, you have no idea that that miracle happened. So when you wake up tomorrow morning, after this miracle has occurred, what's going to be your first small sign to yourself that something has changed? Along with the miracle question, you can ask some other questions that elicit information to help with understanding what outcomes a client is looking for, such as questions about best hopes. Examples of these would be, what is your best hope for what will change as a result of coming to therapy? You can also ask about their best hope for each session or the work you will do together. Best hope should be concrete and observable, so you may need to ask more questions to get there. Other questions that showcase this change could be, what will be different as a result of therapy that would make them or a loved one look back and reflect it was a good idea to come? How will you know that our time together was a good use of your time? Once you have worked with your client to really know what outcome they are hoping for and to create a detailed description of how life will look after this outcome is reached, you can start making plans by breaking things into small, achievable steps and looking for exceptions. You're going to learn more about these coming up next.